like dermatology, gynecology, and many others. Okay, so I mean, this is a trend, but it is a trend in some countries. Here, it's open in the private healthcare market, and as far as I know, in the States, it's the same. You can go directly to the.
Depending on insurance. Medical insurance.
HMO versus PPO.
Sorry.
HMO versus PPO.
I was just about to ask that because my concern in the States would be that if I'm an HMO, I have to have a referral to see a specialist.
Okay.
And so in that system in the US would have to somehow almost work together with the insurance company that if I'm an HMO, I have to go see my primary, then I have to get a referral from the primary to see the dermatologist. I cannot make a direct appointment with the dermatologist because then that claim would be denied by the insurance company. And then the other, even if I have private insurance, there's only certain physicians, I have Blue Cross Blue Shield, which is a huge insurance company in US, you all probably know. It's a closed, so I can only choose those doctors that are contracted with Blue Cross Blue Shield. So the app would have to cross to somehow allow me to put in my insurance information so then I could look at my doctors and then make an appointment that way.
But lastly, is the doctor who makes your appointment in some way, no? Or the one that really gives you the ticket or the okay is the doctor.
The insurance.
So,
Well, if I have private insurance or even public insurance, that physician has to either take Medicare or Medicaid patients or they have to take Blue Cross Blue Shield. If they do, then they're within my choices of who I want to choose.
So it is like here.
Yeah.
So the healthcare insurance companies rule this world of healthcare. No? And
But
so,
you can choose whoever. You can switch or no.
yeah, where I'm going to, as many times as you want. So I had experiences when I was in an insurance company that when women that got pregnant, had about 8 gynecologists following the process because it was great having all these echographies of all the process. It was like a how do you say it, a patchwork. Probably she made a patchwork photos of all the process. It's crazy. The point is that here all the money that insurance companies are paying to doctors, to medical facilities, are much lower than the money that really receive doctors in the United States, about 10 times less than probably. And this is the point. So they can be less restrictive, let's say. So they don't close their hand so much. And
Any more questions? Comments?
comment.
Thank you. Does the tool generate revenue at this point? Are there subscription fees or?
Well, good point. There is a subscription fee. As I mentioned, there is a premium subscription for doctors and medical facilities, but it's very cheap. So we are not a very expensive solution for doctors. We're about with the range of our prices go from €20, $25 monthly to the most expensive thing that we have is 300 $295, $350. Our most expensive service that is great, that is excellent. So you get 3 times more patients than any other in your city and your specialty. Okay, so we are not expensive, and we are willing to work on this direction. That is giving great services, but affordable for everybody. We are a good opportunity, not for great company, for great facilities, for great companies. Let's say we are a great opportunity for small practices or for groups of clinicians. We are giving them tools that if they went to the market to buy for themselves, will be much more expensive. So and this software as a service paradigm, we are covering it. We are getting new clients based on that, on small fees.
So the patient themselves, they don't pay anything to use
Nothing.
this? Okay.
Nothing for the moment. But you know, you can. The good point. The good point is that when you own the company, you never know. Okay, so one of these days, maybe we can start to be competitive. We have be competitors of these healthcare insurance companies. Why not? Why not? We've got the patients. That is the more important thing, the most important thing for them. And we've got the patients, and we have the doctors. We really can talk to all this bunch of doctors and saying, hey, let's make an agreement, and the patients will only pay for that, this amount of money, and I will send you as many patients as I can.
I guess philosophically, is there a challenge at all having doctors who are basically your customers who are paying for you, and then also having the ability to modify and edit some of the patient feedback about that physician?
Well, let me understand. You're saying that is the problem for us is.
No, I said, is it difficult for you if a patient says something negative about a particular physician, but that physician is your customer?
No, well, we try to be very neutral on that. So we really don't allow to as I mentioned, it's not you can't say everything. You can. I mean, let's say it in another way. You can say everything if you use the right words. Okay? If you are using, let's say, the F word, you are out. Okay? If you're using you son of a, you are out. Okay? And this is the rule, and it's not an easy rule because 20% of comments are out of that for us because there's people looking at that, and we had troubles with the court where there was we're not so fast in one comment, and there was a judge here in Madrid asking us who was the one that made that comment, and this person probably will have problems now based on that.
Thank you.
You're welcome.
So I'm a doctor, and I want to pay the minimum.
Congratulations.
Well, let's say I'm a doctor.
Okay.
But I want to pay the minimum amount, $25
Yeah.
a month. How do you? What's the criterion to restrict my access to patients? Is it geographical or what? How is it?
Our criteria, I mean, we have learned, because we are part of the industry, we know that there is a geographical criteria. So we are working in this supposition that most of your clients as a doctor are from your area, from your city. Okay, so we are working in this basis of city and specialty. Okay, and based on that, you can promote yourself. The point for us is that you can the trick. Let's say you pay for having the option to put more information in your how we say it in English, in your profile. Thank you. Than the other ones that are not paying. Okay, so you've got a lot of space, and this really is good for you in Dr. Elia because this amount of information that you are adding, and you are the option to add, is good in the internal searches, but also in the searches that come from Google. In countries where we are really strong in Google searches, when somebody is looking for a doctor, based on that, based on place and on specialty, you will be in the top, not maybe in the top of the list, but probably upper in the list that many others that really are not paying for that. This is unequal. Well, it's our home. Okay, so we do whatever we want.
Which is the ranking of a specialty?
Well, it's well, a good point. It's like in the real world. I mean, there are many. We've got a lot of gynecologists. We've got a lot of pediatricians, because is what we have. They are very used on private medicine. We've got a lot of traumatologists that are orthopedists for you. Surgery, orthopedic surgery. You know, so a lot of orthopedic surgeons, urologists, and that are really very successful. More in the Latin America, because the man in Latin America is so proud that is not willing to ask for a neurologist. Okay, so they go to the internet and they found our information and they find it, and urologists in Mexico have really realized that we are a good source for new clients from them, and otorhinolaryngologist, well, this neck, how is in English, neck? Ear, neck, this. Ear, nose, throat, okay. Ear, nose, throat, and all the, I mean, specialties. You said this as, this is because of the direct access to the doctor. In the UK probably we are not so good as we could be, because all the medicine goes around the GP. There's a general practitioner that's really sending patients to their colleagues or to the hospitals, or to the hospitals where they have agreements. Okay, and this is not. It depends. We have learned a lot because of this idea of the 21 countries, because every country has a different system, and we have learned how we have tried to be adaptable to all that, to all these systems. And we have learned that, for example, it's not easy going to France to do anything instead of having a French working with you, okay? Because they are very weird, okay? So this is, as a rule, they are very weird people, okay? In everything. So we're very strange people. So if they are willing to, yeah. Sorry, you know, but you agree with me, okay? So, or you're out, okay? So, and it was very difficult. Seriously, it was very difficult to start this question of the medical ratings, because the Ordre des Médecins, okay, the General Council of Doctors, let's say, is against the comments for individual doctors, because legalite, no? Égalité, fraternité, all that stuff. The part of égalité, everybody is equal. All doctors are the same. Then nobody that is not a doctor can say that this is good or this is bad, or it was not the best. It wasn't the best day of this doctor. Okay, that is. You can't say that in France, because they will close your website. So, but curiously, you can do that with organizations, with hospitals. Okay, and it's the same. And there is a list from Le Figaro. There is a list, another list. Le Point. So several. There is a tradition of lists of rankings of hospitals and medical facilities, but not a ranking of individual doctors. This is weird or not? Yeah? So that's the point. And this and many other questions that, okay, whenever you want, we can talk about. And let's finish if you want, and later let's go, because there are other people that has came for explaining you the project. Thank you so much for your attention.
So in his everyday life is a physiotherapist, yeah. And he realized there was something like missing in the healthcare sector. He just decided to do an app. So that's why he's gonna present us tonight. So Go Up to Me is an app to locate the defibrillators. So if someone has a heart attack, you know that there's doctor, you know that there's like someone's heart attack, and every minute there's like 10% less chance for that person to survive. So what he did is this app. This app, when something happens, you are next to a person who just had a heart attack. You just press a button, and that will just tell the people around, and those people register before. They say that they can do the ERP. They will come. This will tell this person where the closest defibrillator is, so they can go to that place, take the defibrillator, go to the place of the person, and save the life quicker. So it saves time and saves life. So
disculparme porque